Vyzulta, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
The low hyperemia rate in Vyzulta is huge because all prostaglandins cause hyperemia, but Vyzulta has a very low incidence of that. Because of the hyperemia and the cosmetic issues that causes, a lot of patients will push back against a prostaglandin analog, specifically for those redness and cosmetic reasons. And they will discontinue a medication strictly because of how their eyes look. And that's very detrimental to the long-term health of the patient's eyes and to the options that you have available for their treatment long-term. So the fact that Vyzulta has a lower incidence of hyperemia makes it to where you don't get those same pushbacks and those discontinuations.
So one of the big advantages of Vyzulta is that 5.9% incidence of hyperemia in the clinical trials. That's low. And we see that clinically as well. I think there are patients who typically aren't as adherent as we think until maybe a week before their exam because they don't like the way their eyes look, but they know it's important. They don't have symptoms. Patients with glaucoma don't have symptoms, so they're not acting on that to be adherent and compliant. But they are acting on side effects. And so I think we have to understand that's a very important one. And the fact that you can keep it at a lower level, we don't want to overlook when it comes to adherence to glaucoma medications.
Leaving them on once-a-day medication is crucial because the patient may not tell you this, but they are not fond of it and they avoid it, they forget medication. So as far as glaucoma management is concerned, I would like to see the patients well controlled with one medication and see them about 3 to 4 times a year.
The challenge was always, well, what happens next? If we're starting somebody on a single prostaglandin analog and their pressures are maybe higher than we're comfortable with, what's the next step? Well, up until relatively recently, our next step was add a second therapy. We unfortunately know that means that they have a lower chance of staying on therapy. So because of that, we now have opportunities that are available with still a monotherapy. So with Vyzulta, we really have an opportunity by dropping that pressure clinically.
Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. Vyzulta should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudoaphakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of Vyzulta and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information at Vyzulta.com.